All righty. Hi, everyone. Good afternoon. This is Elisa Vitalich. Thank you for joining us today. We're very excited you have made time to carve out your afternoon to spend with us. Feel free to type your questions into the Q&A box on the side. We'll be sure to address them throughout the call. It's going to be more interactive, conversational, less presentation focused. So feel free to message in the Q&A feature as you have questions as we go, and we will try to address them promptly. If there is anything else that you think of, you can feel free to send us an email as well, and we can address that later. So everyone can see that okay? No? There we go. Like I said, my name is Elisa Vitalich. I'm sure most of you have met me by now, but I'm the new policy director with the Arthritis Foundation. Very glad to be joined by my colleagues, Stephen and Anna today. We are thrilled you have joined us. We hope you and your family, colleagues, family, and friends are all staying healthy and being well. So just a few friendly reminders. Everyone is in a mute and not on video for the duration, except for the panelists. So like I said, use that chat feature, the Q&A feature, to submit any of your questions. And with that, let's get started. We are going to spend a little time today talking about the election results, which I'm sure most of you are well appraised of now. And then we'll dive into some more implications for our Arthritis Foundation specific priorities, advocacy, and policy focus. And then we'll have a little time at the end for more of a longer Q&A session. If there is something that you want to ask that you didn't chat in the Q&A feature throughout, we'll have some time at the end too. So no worries there. So let's dive in. There's a lot of new opportunities. It's very exciting. I am a policy nerd through and through, and I get very excited every election year. It's like the policy holiday of the year. But we have a new administration, new Congress coming up. We have new governors and state legislatures. So there is a lot to dive in. So we're going to cover all of these areas. We're going to start with the congressional legislative landscape. We'll go into the federal administration with the new presidential administration, and then the state as well. So some big ticket items here for you. First, we have quite a few new freshman members. There are 64 freshmen, which means new people, newly elected leaders coming into the 117th Congress, which will begin in January, so pretty early. Their swearing-in day is slated to be on January 3rd, so they can dive in and get started pretty quickly. There are 58 new House members, 6 new senators, and two Senate races that are still undecided. Both of those are in the state of Georgia, which are both going to be in a runoff election. So excited about that. We'll stay tuned. We'll keep you updated on how that goes. All of the 435 seats in the House were up for election. As you know, they are up every 2 years. So we saw 50 House seats that changed this year. The Democrats are still in the majority here. Nancy Pelosi is still likely to, she will maintain control of her gavel and will be the Speaker of the House. But the House Democrats did see 8 seats shift over to the Republican Party. So this narrows the margin from Republican and Democrat sides of the aisles. Literally how they seat people on the congressional floor has a literal aisle. So we see that aisles narrowing quite a bit. There will be 222 Republicans to 207 Democrats. Did we get that backwards? Sorry. There we go. Flipping over to the Senate, 35 of the 100 Senate seats were up for election. As we know, the Republicans are maintaining their hold so far, but that is pretty narrow. Again, we have those 2 Senate seats in Georgia that are up. My personal opinion, Anna, Stephen, feel free to chime in if you disagree, but my personal opinion is that it'll likely stay in Republican control. I anticipate both of those seats to be won probably by the Republicans that are running for those 2 seats. But you never know. We've seen a lot of voter turnout. There's been a lot of change this year in Georgia. We saw it turn blue. So it could happen, but my personal opinion is that it'll likely stay red for those 2 Senate seats. We did have 1 net loss for the Republicans and 1 net gain for the Democrats in the Senate. So pretty standard there. Flipping. You see? Yep. So the overall landscape is relatively similar. Honestly, it's pretty close to how it is now. It is slightly narrower. The current 116th Congress, 232 Dems with 1 vacancy to 197 Republicans and 4 vacancies, as opposed to next year, starting in January when we swear in the new congresspersons. We did see the new senator from Arizona sworn in yesterday into the Senate, so that's very exciting. Astronaut Mark Kelly. So that's the new update here. We'll have our likely we'll see the same majority leadership in the House and probably in the Senate as well. But Anna, do you have any thoughts on congressional impacts so far? We're going to dive more into the committees, but would love to hear if you anticipate any overarching broad landscape changes or things that we should be attuned to just in these highlight election results.
I think that the way that the House and the Senate currently operate with each other is not likely to change terribly. I think a lot of the healthcare priorities that the House has put forward this session will continue to be priorities in the next. It'll be interesting to see what happens in the Senate. Even if the Republicans retain the majority, it will be smaller. I think the biggest test will be how the Congress, both the House and the Senate, interact with a new administration of a different party. And the relationship and the dynamic that will play out there will likely be different than the last time there was a Democrat in the White House. But that's the dynamic will take shape fairly early on. We'll have a good sense, I think, in January what that's going to look like. And I'll be very personally eager to see how that plays out. How about you, Elisa? What are your thoughts?
Yeah, I know we've talked a little about it, but I'm wondering how much do we anticipate the opportunity for COVID-19 to kind of take full front, main screen image in the beginning of the new year. I think we'll dive more into the Biden administration, but as far as like relief packages go, Congress is talking about this now. We're looking at, how much worse is the pandemic going to get in the months of December, January, getting into February even? And do we see opportunities for us to play a role, not just in our priorities, but broadly? Do you think this is mainly going to take over Congress's viewpoint, or do you think they're going to talk about anything else in the first couple of months?
I think this is going to take over everything. And if you all saw the news today, that it looks like there may be agreement now on a new stimulus package. We'll see if that actually moves forward and what's included in it. You may also have seen that there's renewed interest in surprise billing legislation, which we've long been supportive of, and we'll see if we get that over the finish line. So depending on what they can get over the finish line in the next couple of weeks, I think will dictate how much rolls over into the new year. The other wild card is going to be around appropriations, I think, because the current continuing resolution is keeping the government funded ends in just a few days. And are they going to punt and do another continuing resolution that the new Congress is going to have to grapple with or not? And that will take some of the oxygen in the room as well if they do that. So that will also be interesting to see how that plays out.
Yeah, and there's continuing resolutions are not unusual. We see them pretty commonly for appropriations. So this is not alarming, but it is interesting, like you said. How are we going to play now in a lame duck session? It's kind of the end of the year, but it's pretty unusual to have such intense of a focus in the public view, not just on a pandemic response, but on economic response and on healthcare and preparing. And usually it's kind of more of I don't want to say a quieter time, but usually Congress is trying to push something through last minute, a last hurrah. And it's interesting to see such forward-thinking momentum, if you will. We're trying to move things ahead and bide our time and see what we can do before we get into a new Congress where we'll have different representation and new leadership of the administration too. So it could be interesting. I personally think maybe we'll pass something this year. It might be like a Band-Aid. I think we'll see a lot more happen in the new year and after January 20th, after the presidential inauguration. I think we'll have some more robust legislation, if you will, is focusing on COVID, but other topics as well. Anna, before we dive into more on the congressional committees, we have so many new members. Can you tell us a little about what to expect with our advocates and ambassadors when you're meeting a new member? Do they know anything? Does their staff have a clue who we are? How do you find that we start building that initial relationship with new members of Congress?
Thank you for that very loaded question. Do they know anything? The answer, no. Or not that they don't, but I think if you are an advocate, either new or you've been advocating with us for a very long time, it's always good to assume that that a freshman member of Congress is coming in very green. They have of course, it's different now virtually, but typically they come in for orientation where they literally come. It's like coming to school. They come up to Washington and they have this formal training about the rules. They have to learn the rules of the legislature. It's very convoluted and complicated. They get their committee assignments. It's like, going to college and getting your class schedule. So they're dealing with all of that. They're staffing up. I always think about an office, a congressional office, almost like a small business. They're managing a budget and they have a small staff and they're trying to kind of figure that out. They're also trying to figure out their niche. What are the issues that they really want to take on? So that's where it's really important and a really good opportunity to get in early as a constituent, as an advocate for healthcare issues, to say, these are the issues that are really impacting me. This is what you can do. You can put your stamp on it. Joining the Arthritis Caucus. I know we'll talk about that in a little bit, but things like that, where you can show your support for people with arthritis, getting in there early with those messages is really critical.
And what
one other thing, because I think this is really important too, especially for the freshman members, it often takes them a while to staff up. So I wouldn't call them, call their office on January 3rd and anticipate that they're going to have a health staffer lined up. So it's great. Some of them do. And then that's great. They have someone dedicated to healthcare issues, but oftentimes it takes them several weeks to hire and fully staff up. So it may be a little while before they have someone dedicated to healthcare issues that you can talk to. So making friends with their scheduler or legislative director or anyone like that is a good idea as well in the meantime.
And Anna, are all of the congressional staffers from the state where the member lives?
No, oftentimes they are. I feel like when I was on the Hill many moons ago, that was always a preference that you're from the district or at least from the state. You kind of know the area, you know the people, but definitely not a requirement. So that's always a good, I think, icebreaker when you're meeting with a health staffer for the first time to ask, how long have you been with the member of Congress? And are you from the district? And it just opens up some good lines of communication before you get into the really meaty stuff.
Yeah, absolutely. I think it's nice at the state level too. They're new members, they're new staffers. I think regardless of where you're coming from, most of the staff are relatively young folks. They're new, they want to know your story. I think it's a great icebreaker, as Anna said. Tell a little about who you are, where you're from, ask the basic chit chat kind of questions to kind of warm up the room before you dive into your really meat and potatoes of the issue of why you're there, or just telling them who you are. I think that's a great way of how we start relationship building with staff members, especially. And one of the questions, email or call preferred? I think either. If you call, you're probably going to get an intern, for example, who's going to answer the phone first. But that's okay. They're taking notes. They'll pass it along to the Health LA when they have one, or the member if it's urgent, depending on how their staffing ratio is in the beginning. I personally loved calling and talking. I worked as a state legislative aide for several years. Loved having people call in and tell their story. Email is always preferred if you're trying to set up like a hardcore meeting, if you really want to, set time to prioritize your message and share, these are our top 3 priority points. We'd love to share more information with it about you. That's great to have like a scheduled meeting so that that their time is dedicated. Someone will be there to talk with you. And I've had several friends who were current Hill staffers talk about it's great to be able to have Zoom chats with multiple people, multiple advocates at the same time. You can all chime in about, they can give you a longer period of time that way too. It's not a 5-minute hello, I answered the phone. It can be a little more in depth that way as well. Anna or Stephen, do you have thoughts there?
I would say, like, as Stephen can chime in on the state side, but on the congressional side, especially if you have a new member of Congress or even a returning member, they have a lot of turnover in staff as well. If you're not sure who the Health LA is or who the right person is to talk about an issue, picking up the phone and just calling their general office line and just asking the person who answers the phone, can you tell me the name of the person who handles healthcare issues, so that you're kind of learning who's who in the zoo. And then from there, you can get that person's email address and then start a dialogue with them that way. That's what I do as a staff member. So I would recommend that for our advocates as well.
I was going to say, I do that exact same thing. If I'm wanting to reach out to an office, whether for kind of maybe a legislative day, scheduling visits, or doing kind of shopping around, or scheduling a meeting for our purposes of lobbying, most time if I don't have it in a directory or in our system of who that is, or like Anna said, there's staff turnover quite a bit on the state level where you may get a bounce back, is that just call their office, just say, hey, who covers health issues for your office? And not even trying to talk with them then. They're usually very busy, they're running around, they're covering committees. But just sending an email, I like email from that start basis, as far as whether scheduling a meeting or just sending over some information, because then it sets that record. And then if you want to jump on a call or schedule that call to kind of dive deeper into the issues, then that's great. But I like the record of kind of having some information and doing it that way. But I think usually call is the best way to get that information, because usually there'll be someone to pick it up normally. But I think Anna hit on something that I just want to address real quick, as far as even on a state issue, state side especially, just because federal offices, usually there's some elected office that they've had previous, whether kind of on a local level, on a state level. So they usually have had some relationship with health related legislation. But even then, especially state legislators, they're coming from owning a business. They're coming from the military, coming from, like Elisa said, we have an astronaut that just got sworn in. So some of them are not very familiar with health related legislation, not related with arthritis being such an issue that it is. So I think that just reaffirms something that we always say, as far as you guys are the experts on this. These are people that don't know health related issues as well as sometimes you do, as far as insurance issues, what you go through. So just always be confident that you're going to be sometimes the expert more so than them, even though they're these kind of big elected officials.
And remember, you're the one that elected them. Maybe not you specifically, but we the people elected them. It's our house. We are representing our interests, and that's exactly what they're here to do. Their job is to listen to you. They want to know your story. They want to know the information you have to help them make those good decisions.
Because Mark Kelly's name has been brought up twice, I can't help myself. But some of you may remember that what the last time our Conference of Champions was in Phoenix, what was that, 3 years ago, maybe, or 4 years ago? 3 years ago. I've lost track of all time. But Mark Kelly was our keynote speaker. And so if you're from Arizona and you're wanting to make that connection with his office, you could say, you spoke at the Arthritis Foundation Conference of Champions a few years ago, and et cetera, et cetera, et cetera. That's a good door opener as well.
I love that. Yeah, that's a great way to kind of make an end, make a start. Even with staff, they would find that entertaining, I'm sure too. I grew up in West Virginia, and I've made jokes about how I miss pepperoni rolls with our Arthritis Caucus co-chair, Representative McKinley. So anything little, it doesn't have to be a major point of topic. So but want to keep us moving on a little bit. Feel free to, again, ask your questions in the chat or Q&A feature on the side, folks. That was a ode to Joe Biden there, folks. We will keep moving along, and Anna is going to kind of talk with us about the impact on the congressional health committees. Take it away, Anna.
Okay, so this is where it gets kind of interesting. On the Senate side, if the Republicans retain the majority there, we're going to have a different chair of the Help Committee. The Help Committee is the one that has jurisdiction over public health programs, which is a lot of where we spend our time, of course. Lamar Alexander from Tennessee, he was such an establishment sort of institutionalist, and he was a very stalwart public health person. So, he was a good office to work with. The two people who have kind of seniority behind him are very different. Richard Burr and Rand Paul have completely different styles. So it'll be interesting to see what happens there. either way, we'll sort of be working with the committee staff and others to advance our priorities there. And it'll be good to do a follow-on webinar when we have all of the chairmanships sort of announced, so that we can really get a sense of what the personality of the committee is going to be with that particular chair at the helm. Patty Murray from Washington is the ranking member currently. And she, again, just like Lamar Alexander, longtime tenure in public health. And I know those of our advocates from Washington State have spent a lot of time with her and have good relationship with her. So that's not changing. We, unfortunately, Doug Jones from Alabama, who was our Democratic co-sponsor sponsor of our step therapy legislation, which we worked very hard to get introduced in the Senate, he's not coming back, and therefore we're going to have to find a new Democratic champion on that particular piece of legislation. So that's one thing very early on. Will, as the Arthritis Foundation, be focused on who's going to be our Democratic champion now on that particular piece of legislation. I'm getting a little ahead of myself, but again, I can't help it. Okay, Senate Finance Committee. This one's going to be interesting too, because of the fact that a lot of the drug pricing legislation that was a huge focus early in this Congress, that is the main committee of jurisdiction there. And we're going to have a little bit of a change up there as well. The current chair there, Chuck Grassley, is term limited. Mike Crapo, senator from Idaho, is next in line. He's been around a very long time as well, also kind of an institutionalist that way. So it'll be, I don't know that the quote personality of the committee will change all that much, but he'll certainly want to put his own stamp on things, and we'll have to sort of see what his priorities are. And we'll get a good sense of that from all of the committees kind of early on as they start to set hearings. They'll set hearings on particular issues and things like that. So we'll get a good sense, I think, January, February of what the focus is going to be within those committees. On the House side, Ways and Means is not going to have a leadership change with Richard Neal from Massachusetts maintaining the chairmanship there. So I don't anticipate seeing a whole lot of change there. There is a lot of the priorities that we have really pushed this year that haven't gotten over the finish line. Hoping we'll see them again in the next Congress, including capping Medicare out-of-pocket costs. That's a huge one. This is the primary committee of jurisdiction there. So we'll kind of continue along the path that we've built this year on those particular issues. Energy and Commerce will see a little bit of change. Frank Pallone will remain the chair there, but we actually, this just in today, Kathy McMorris Rogers is going to be the new ranking member. The minority leader, Kevin McCarthy, just announced that today. And I know that we've had a lot of advocates with strong relationships with her over the years. So we'll definitely want to sort of shore that up and see what we can do there. That is the committee with jurisdiction over a lot of the public health programs. So another really important one. Appropriations, this just in. The chair, currently Nita Lowy, is retiring, and we've got Rosa DeLauro from Connecticut, who was just chosen today to be the chair of that committee. That's really good in the sense that she is a longtime public health advocate and an advocate of our particular issues. We've worked long with her office on CDC funding, NIH funding. So I think she is going to be a good advocate for our particular programs. So that's a big new change happening this year or for next year.
And Anna, are all of these committees pretty influential? What would you say, what's the level compared to other committees that we might be working with or seeing bills pass through?
These are the core committees that we're going to be working with. So Energy and Commerce and Ways and Means is where we're going to get a lot of these authorizing bills over the finish line, which include, surprise billing, step therapy, the capping out-of-pocket costs, anything like that. We're going to be looking at those Ways and Means, Energy and Commerce, and then Education and Labor committees. The appropriations committees are are key though for getting any federal funding over the finish line, which is critically important. And that's one of those areas where in some places, this line that we've internally started using, but I can't take credit for it. It comes from one of our National Advocacy Committee members, but for the Arthritis Foundation, who would do this? The CDC Arthritis Program is a great example of that. If not for us, who's going to really push that funding? So the Appropriations Committee is really key. And those of you who followed our pediatric loan repayment program work know that we got that authorizing legislation over the finish line this year. Now we have to get it funded. So that'll be a huge push early in the next Congress to try to get that $50 million funded through the appropriations process. So anybody who has good relationships with Rosa DeLauro or any appropriators, we're going to be calling on you and really hoping that we can put a lot of pressure to get that funding over the finish line.
And speaking of moving things and starting fresh with a new Congress, every time there is a new congressional session, all of those bills and bill numbers kind of disappear, if you will. We have to start fresh once again in January. So every new piece of legislation that we've worked on or imagined, things that'll come down the pipeline, they will start again. Bill number one will start, 1 through a million again, and we'll keep going. But new bill, new session. Are there things that you think, we'll talk more about special topics later, but any particular bills on top of your radar that we're definitely going to be pushing for this year, Anna?
Yeah, that's a good reminder that we do have to start over. And I know that can be really frustrating, but I always think of, the federal affairs as a long game. It's very rare that you introduce something in a session and get it passed in that same session. And our former state advocacy lead, who many of you will remember, Mark Guyman, used to joke that, I had one bill that we'd be working on for years and years and years, and you would pass 20, 30 stateside in any given year. So what we do really on the federal side is build momentum. Each Congress, we build momentum. The more co-sponsors, the better chance you have of getting a hearing on that particular bill. You get a hearing on the bill, the better chance you have of getting it marked up and then ultimately put on the floor for a vote. Step therapy, the Safe Step Act will certainly be one that we're already working closely in coalition to think about how we get that reintroduced. We built a huge number of co-sponsors this year on that bill, which is great. I know that this is going to sound interesting, but this is only the second Congress that we have had step therapy legislation. So in my mind, it's still kind of that bill's still kind of a toddler, if you will. I'm hoping that this Congress, we really will. I mean, we've laid so much groundwork and that we'll be able to possibly get it over the finish line this next Congress. We will see, but that will definitely be one that we're focused heavily on. And then, like I said, some of these big ticket ones that have a lot of attention and support around, like surprise billing, should that not work out this month, and really doing some things in Medicare to protect Medicare beneficiaries from high out-of-pocket costs in the prescription drug benefit side in particular. And then a lot of it, frankly, will be reactive. We don't know what's going to happen with drug pricing legislation that was such a hot topic this Congress. Will it continue to be next Congress? Maybe, or certain aspects of it might be. We're not sure. And then I think there will be a lot of emphasis, and Elisa, I would love your thoughts on this too, around just general patient protections, whether it be related to the Affordable Care Act or not. Discrimination protections for people with pre-existing conditions, shoring up things that just really need to be paid attention to and maybe haven't in the past few years for one reason or another. It'll be interesting to see how much emphasis there is there early in the year too.
Yeah, we can talk more about this when we get to the Biden administration. I think that's going to be a major aspect. The Supreme Court is currently evaluating the ACA. Early indications kind of show maybe it'll stick around. It doesn't seem quite as controversial at the moment, just based off of two of the justices' comments. However, the final decision will likely come in June next year. So until that point, the ACA is secure until June at the earliest. But I do see, Congress potentially considering an expansion. I don't think if the Senate stays Republican that we're going to see, widespread coverage opportunities. But I do think there's potential here. We can dive more into it, but I want to make sure we get to the state level side and we have a whole session at the end just for issue topic brain dump, so I can give some more personal musings there. But Anna, one final question on Congress while we're talking about the Arthritis Caucus and bringing new members in. Is there anyone on your radar that we are especially excited about, or how should our advocates invite if they have a new congressperson or a current newly elected person, or someone who's not newly elected and has been there? What is your suggestion for how we invite them to join the Arthritis Caucus, and who do they go to?
Well, so we had 128 members of the Arthritis Caucus going into the election. We lost 14 members, which isn't a terribly large number, but we definitely want to rebuild. Anyone we have on our radar, I would say literally every single member of Congress we have on our radar. There's no reason not to shoot for the stars. Let's have all 535 members of the Senate and House join the Arthritis Caucus. Certainly freshman members. Again, I always, whenever I talk about the Arthritis Caucus in Hill offices, I always message it as a good way to, an easy way to show support for people with arthritis. It's not a legislative caucus. You're not putting your stamp on anything legislative. It's bipartisan. It's bicameral. It's mom and apple pie kind of stuff. What we're hoping to do is, really work closely with those co-chairs to set an aggressive agenda to really bring arthritis issues up to the fore in this next Congress. Some of the core issues that you all have heard us talk about for a while now around, access to pain management and really just addressing issues around, chronic pain and things like that are very much of interest to this particular Arthritis Caucus co-chair contingent. So I think there's an opportunity to really draw some attention with the Arthritis Caucus in this Congress. So I think what might be helpful is for us to put together some talking points for you all, so you kind of know what we're hoping the Arthritis Caucus might do. And we're hoping to really be able to do some deep dive policy roundtables and other events with the caucus. And so that's another benefit of joining the caucus, is that you get access to those things. And again, as each member of Congress is trying to figure out where they want to put their stamp on any given issue, and there are so many issues that are going to come their way, this is just an easy one that they can show support for you as their constituent, and for the people with arthritis in their districts as well.
Anna, we have one question from Roseanne that just came in. I'd love your thoughts on it. Do LAs have their own business or Congress-focused Twitter accounts, and should we follow in addition to the members of Congress accounts?
That's a good question. I don't think so. Most of them will probably have personal Twitter accounts, and they're probably following their members of Congress or their bosses. So if you are tweeting at your member of Congress, their staff is probably going to see what you're tweeting. Whether they have sort of business Twitter accounts, kind of like we do for the Arthritis Foundation, I don't know that that's a standard practice, but I don't
think so either, actually. I think it's a personal account if they have one. I would think not for most folks, though.
Like a spokesperson, but sometimes you'll see that a lot with campaigns, but even sometimes the office, maybe the communications director may have something, and sometimes it may strategically make sense to follow them or develop a relationship with them through that. They may follow you as a result of it, and you can go that route. But sometimes it may be good to know if it's is it more on the personal side and that they may tweet about stuff like that, or is it something where they're keeping it mainly related to their work, but I don't think there's kind of an official capacity that any staff person would have in the same way that their boss would. But sometimes I've seen some benefit of following those types of staffers for just inside baseball as far as what's going on, or sometimes members aren't good at tweeting. We know all about people that aren't good at tweeting, but sometimes it's good at that aspect of it. If you're finding your members not doing well as far as communicating via social media, then that may be a pathway. You can always see that through kind of who they're following. That's always a good way to test too, as far as what their interest is. What is this member working on? You can kind of see what types of groups and organizations are they following? Are they following their staff people and stuff like that?
Yep. And in addition, all of your arthritis advocacy staff, we all have our own Arthritis Foundation Twitter accounts. You can follow me and Stephen for your most policy nerdy updates, if you will. It's both our first name, last name, AF at the end of it. You can find us on the Regular Arthritis Foundation Twitter account, and we'll post other things there. Stephanie, I know we had a couple of questions that came in. Stephanie, do you want to, any good ones we think we want to ask real quickly before we move on to state?
Yeah, there was a great question about the caucus asking if current or existing members need to re-up in the new Congress. And Kristen answered and said yes, but I'm not sure if you want to explain that process a little bit more.
The caucus itself, they don't. We just roll them over. So it's more of an opt-out if they no longer want to be on the caucus. But once you're on, we just consider you to be on indefinitely.
All righty. Any other questions?
We'll also update the list because it's not necessarily publicly available. I mean, the caucus co-chairs may have a list on their website, but there's not like a formal public place for caucus memberships to live. So we on our end will update the list and make sure to send it out as follow-up so that you know, and you can sort of cross-check and see if your member of Congress is on there.
Awesome. And we had one other question that came in that I'd like to pass off to you all as kind of issue or topic specific, but it was, I guess, mentioned on one of the state COVID updates, I assume a teletown hall or something like that, that mentioned that arthritis related procedures or non-necessary procedures might be canceled to make room in hospitals for COVID patients. And so they're curious about what our thoughts on that have been as it happened earlier in this year and what our outlook is on that possibly for the rest of this year and this winter.
Well, I do love COVID. I used to work a lot with infectious disease control issues and vaccines in past lives, but happy to talk about this more offline. I don't want to take over with COVID, but that's mostly a state or local issue. There are a lot of guidance, guidelines, regulations that the federal government can make. HHS can make recommendations, but most of those actual decisions are going to come down to the state level. So if you find a hospital that is saying we're no longer doing elective surgeries right now, that's a hospital system decision. That's not even necessarily a state decision. So state, local, the same will be true with vaccine distribution and allocation. That's going to come at a state level. So the federal government is allocating them. We could do a whole thing on this later. They're doing a whole allocation based off of state population. The CDC's ACIP, their advisory committee on immunization practices, made a recommendation for phase 1A group of people who will be the highest priority to get a COVID vaccine. After that, every state submits their own plan for distribution to the local level with like the nitpicky little nitty gritty details, and that'll vary by state. So we can have more policy deep dive into that topic. I personally am obsessed with it, but want to keep us on track here for elections focus for right now, and make sure we get time with about 20 minutes left to hop over to state issues. So Stephen, can you tee us up for some of the exciting state elections overviews that have happened?
Yeah, that was, in a way, you did a good job of tying this in as far as kind of the next subject. And it's obviously the subject that I think everyone came to listen here today. I think everyone's more interested in state versus federal.
They don't have state. I love state. It's where stuff happens. It moves quickly. It's close to the people.
Absolutely. And so, yeah, let's talk about state. So we had 11 governor's races this year. I think most of them, as you'll see there, we only had kind of one that was really classified as a toss-up, as one that kind of changed party hands, and that was in Montana. Greg Gianforte defeated the challenger. The previous governor was running for the Senate seat in Montana. It was a battle of the Steves, Steve Bullock versus Steve Daines, and Steve Daines kept his seat. But every other governorship stayed within, whether it was an incumbent winning or the party keeping that seat. And that's kind of a theme that you'll see on the state elections this past year. Is kind of almost somewhat of a status quo, overarching. There's kind of individual seats that changed hands, some leadership in particular states that may have lost, but I think from an overarching view, I think it was an election of kind of a lot of things staying the same, from the governorships to the state legislatures staying within the same parties controlling the chambers. I think there was a lot of talk before the election as far as maybe some chambers changing hands. And really, we only saw two change from one party controlling that chamber in a particular state legislature to the other party changing that. And that happened in the same states, both in New Hampshire. The House and Senate in New Hampshire changed from Democratic control to Republican control. But you'll see there we have kind of the current breakdown of where things land right now. We have 26 Republican governors, 24 Democratic governors, so almost pretty even currently. We have 24 of those states where Republicans control the governors and the legislature, whereas just 15 with Democratic governors and legislature, so what we would call a trifecta. And then 11 where it's a divided government. So most of those, if you're doing the math, you'll see that most of those are cases where it's a Democratic governor and a Republican legislature having to work together. And that's not necessarily a bad thing. I always remember kind of a quote that's attributed to a federal state, but I've even heard state legislatures kind of mention it as far as that the other party might be the opposition, but the other chamber is the enemy. So that, I think you may kind of think of the tension between the parties as something that could be kind of driving in these discussions as far as when we go into the next session. But I always kind of want to focus on the fact that sometimes the fact that there may be some tension between chambers, that the upper house, the Senate in a particular state may have tension and may be more moderate or may be more progressive or more conservative than its opposing chamber, and they may have different kind of perspectives of what they want to accomplish. So it's not just kind of party politics that are playing a factor in some of these situations where there may be divided or trifectas.
They love to say they're upper. They love to be the upper chamber.
Oh, absolutely. And then I think the fun fact is that we only have one legislature that is split control, or in Minnesota, you have one party that controls the Senate, one party that controls the House. Every other state has party control from the upper chamber to the lower chamber. And then 4 states have veto-proof majorities in the legislature. So you have with an opposing governor. So Vermont, Kentucky, Kansas, Maryland. Vermont and Maryland have Republican governors and veto-proof Democratic legislatures, whereas Kentucky and Kansas have Democratic governors and Republican veto-proof majorities. And like I said, even within a veto-proof majority, there may be factions within that. So that doesn't necessarily mean that everything that they vote through to the governor and gets vetoed doesn't necessarily mean that they'll be able to kind of rally those votes again. It's good to note, but there may be factions, there may be moderates, there may be people on the outskirts of that. So, but I think these are just kind of good factors to be able to keep in mind going into this upcoming session. So why does this all matter? I think from a governor standpoint, we note this just from the fact that they may not be in the legislature. A lot of governors don't weigh in once on pending legislation. I've worked in interning for a governor that just would not comment on pending legislation, whereas you may have governors that do have bill packages, the lieutenant governors that may have bill packages. But for the most part, they'll weigh in quite a bit on kind of budgets, on taxes, or have an overarching platform of what they would want to see the legislature come up with and do. But then, so they can influence it that way. But you may have some governors that do some active lobbying on some of these issues. So it's good to know kind of where things land and how they feel about their legislature. Then legislative control just matters just because they're the ones that are going to be setting these priorities. They're going to be the one that kind of are trying to pass this and work together within their legislature. So knowing kind of where things land at the moment is very important. And this is just an overview. Each particular state has its own little idiosyncrasies and things about it, but I think this is just a 1,000-foot view.
And Stephen, like Congress, once there's a new session, we start over again with bill numbers and introducing new legislation, but all of the states don't necessarily start at the same time, right? So we can have different, inauguration dates and different anticipated session calendars. Is there kind of a general time frame that you might be able to give us a sense of when states are going to start rolling in with new legislation?
Yeah, I think middle of January is usually the most common. So they'll usually give a couple weeks to kind of get things around the holidays. I think the earliest one that kind of technically starts is one that's close to me in California. They swear in legislators in the first week of, in a couple of days here, in the first week of December. But then what they do is just kind of go back on recess. But you may see some bills drop at that time. But then even later than that, on the later side, you may see states that don't really start it until February. And most of those are states where there's weather permitted, as far as kind of, it's just kind of an old tradition as far as, let's not start kind of right in the middle of winter. Let's get closer and closer to the spring. And it ranges. There's some states that go all 12 months. There are some states that only are limited by their constitution, but by going just a month or 2 months. So like you said, it really ranges based off your particular state and what they want to do. But sometimes, like Anna alluded to, on a state level, they can accomplish a lot in those weeks or months, just because their focus is on passing their budget, on getting through a lot of things. They also don't have to worry about a number of things that on a federal level that you have to deal with. I think notably defense, but I think it's something where those definitely range state by state, but tends, I'd say, kind of January to May, June is kind of probably the most common.
Perfect. Well, like you said, focusing on impact, what is the state election result impact on our healthcare priorities and healthcare broadly at the state level?
I think for those that are familiar with us, I think we saw the impact that COVID had on state legislatures right off the bat last year. I know that we were in the middle of session for a lot of states last year when COVID really shut down everything. In March, that's right in the middle of that zone that I just kind of gave. And so a lot of legislatures shut down. A lot of legislatures either limited their legislative issues to just budget related items or COVID. And so we may see a little bit of that this year as far as kind of their impact, as far as maybe some legislatures may just go into this session and say, we just want to accomplish our budget, which is required by Constitution and important to get resolved and get out. Some may be able to, based off of more normal use of technology, be able to do their legislature by that. Some may open up limited based off social distancing or how quickly we're able to get vaccinations done and everything like that. But I think they'll definitely be having to deal with state budgets. Some states are in okay shape, especially if we're able to get kind of federal funding here that we just talked about. Some states are really struggling and will have to make very tough cuts. I think the biggest impact of that would be on things like Medicaid, which is just such a huge percentage of state budgets and something that we watch very closely. And sometimes our legislation deals with Medicaid, or we're adding protections that we would to the commercial market to Medicaid that we may have to say, maybe not something that we can do this year because of that. But I think we'll have to evaluate that state by state as far as kind of where will be opportunities for us, where kind of states will be dealing with things outside of those kind of larger big picture issues, and they can really focus on patient protections. And you may see us tie that a little bit more to what we usually work on, from kind of step therapy, accumulators access issues, and make sure that we note to these legislators how COVID can really impact those issues and those patient protections as a result of our patients not having that access to care. And then the last thing I'll note is that we did have a victory in the state election cycle. It was a ballot initiative that we did support here in California, where I am based in, but it was a ballot initiative on the reauthorization of the California Institutes for Regenerative Medicine, or called CIRM, dealing with stem cell research that is about a $5 billion allocation. I think they try to sell it. The best way to describe it is CIRM is kind of California's National Institutes of Health. They do a lot of research, whether from kind of theoretical and do a lot of papers and research that way, or just actual development of actual therapeutics that they're going to be working on and advancing. So it's something that we're hopeful, and we already had conversations with them about kind of ensuring that that arthritis is amongst their top priorities to work on, and we'll continue to advocate for that at CIRM like we do with the federal agencies.
Stephen, I have a question for you that might be a good segue into the deeper dive policy priorities, which I know Elisa is eager to get to. And that is, if I'm an advocate and I want to talk to my state or local elected official about a particular healthcare priority, that budget impact issue that you were talking about, how much should I factor that into what I say? So maybe there's a piece of legislation, say accumulator adjustment programs, that doesn't cost money. It doesn't have a fiscal note attached to it. It's going to be budget neutral. How much should I prioritize that? And then how might I go about finding out if a particular piece of legislation or a priority is going to cost money? Do I contact you, Stephen? Should I expect that in talking points that I'm going to get through action alerts from my state chair? Tell me what to do.
No, those are great questions. And I think you said it well, that there are going to be, I think, a prioritization of issues that are or budget friendly, quote unquote, like accumulators, where that's not going to touch a state budget. It's going to, or issues that could, because their relationship to Medicaid, like we've had step therapy reforms that touch the commercial market and Medicaid, but we may kind of have to really think about that in a particular state and say, maybe we'll just focus on the commercial market for that bill this year, and maybe go back in a future session when maybe the state legislature is doing better, or kind of funding's going into the state better. And so I think it's going to be case by case, but I think for the most part, there are going to be a lot of states where issues that really impact the budget, it's going to be a tough year for that. But I think there's a way of selling that in cases where we're really having to advocate for those pieces of legislation of showing the importance. Sometimes those budget allocations are looking at the front end. So they're looking at maybe kind of selling step therapy as in their budget allocations as something that would kind of, in essence, put patients on higher price medication, but they're not factoring in the back end of those costs in their budget allocations and saying, well, if we put the patient on the right medication now, then they may avoid emergency room visits, may avoid getting a non-adherence to that medication. And so I think that's always going to be our target point as far as any fiscal note or any impact to the state on these types of issues usually are kind of looking at the front end as opposed to the back end of cost. So I think you're right that we'll have talking points on that. That's something that you can always reach out to me. Kristen Crawford's usually going to be your source on a state level as far as kind of our grassroots and our relationships to virtual days that will have those talking points. So I think she's a great first point of contact, but I think I'm always here to assist with that. But just know we're here to talk about that. But I think it's good to note when you're contacting a state legislature that when we're talking about these issues, that could be front of mind as far as kind of budgets and shortfalls and what they're dealing with on that end.
So I'm very excited to get to my personal favorite part. We have 6 minutes left. So this is your time, Q&A. Hit us up with all of your questions. We're going to move into Biden administration, other health priority topic areas. This slide, we just threw up some of the top priorities that we think are going to be major topics of interest in Congress and the Biden administration. None of these should look brand new to us. They're all topics that we've been talking about at least for the last several years. But, we'll have the 46th president. The inauguration's on January 20th in 2021, and under a new a new Democratic administration comes new leadership throughout all of the executive offices. So you've seen, several new cabinet members, secretaries, and other kind of appointmentships being announced from the administration and in recent days, especially. We will be especially attuned to Department of Health and Human Services, of course, CDC, NIH, looking at, a short list of contenders to take up the helm at HHS, but that cabinet post is kind of yet to be announced. But these are some of the priorities, and I'd love to hear both of you give highlights of how you think they align with our Arthritis Foundation priorities. But really, I think we're going to see a refocusing, very intense on COVID-19 response, public health, and science infrastructure, especially. You can see that already in the coronavirus task force that the president-elect has announced. All are pretty much experts with PhDs and well-respected in their communities and fields. So I think we will see a emphasis on healthcare, especially, and particularly in public health and infrastructure in that part. I think, as Anna mentioned earlier, there are some regulatory opportunities for ACA, but also the SCOTUS ruling we anticipate coming out in June. I think we can expect to see kind of a reversal of several of the current administration, soon to be previous administration changes to the ACA. We're talking about increased flexibility for short-term limited duration health insurance plans. High deductible health plans would probably fall into this reversal category. There might be some interesting movement on Medicaid waivers that are related to allowing for work requirements. And at least from the Arthritis Foundation position, we've really expressed that concern about STLDIs, work requirements for Medicaid in the past. So I think we will continue to support these rollbacks in a new administration. We've also had a long support for making sure that comprehensive health care packages are available for our patients. We know that that is the best form of insurance, and we want to make sure that the ACA is strengthened to provide that opportunity for our patients and our advocates. So probably a more concerted push around affordability as well on exchange marketplace plans, talking about out-of-pocket limits and co-insurance percentage changes. Anna, I know we've talked a lot about drug pricing reform. That's been a hot topic. Increasing or restricting for patient assistance programs, as Stephen had talked about. But any thoughts there on other patient protections or drug pricing issues that you think are top of mind? We have 3 minutes left.
Well, my 30-second elevator pitch on this would be that, like any administration, it's going to be a mixed bag. There are going to be things that are aligned with our priorities. There are going to be things that are not. My biggest priority is to advocate to this administration how important engaging with patients is in designing any healthcare policy. If the end user is the patient should be part of the process from the beginning. This is something that we do all the time in all corners of healthcare. And so pulling that up, my tagline I've been using lately is moving beyond lip service, how to make healthcare truly patient-centered. It's something that everyone wants to pay lip service to. Let's put that into action. That's going to be my focus with this administration, no matter what the priority is, good, bad, and anything in between.
And I'll just say, I think you're dead on, Elisa, as far as kind of the market stabilization effort. And I think we'll just be watching the states. I think there's a perception that kind of, it's federal, there's going to be limited impact on kind of states. But I think with market stabilization and with the number of kind of Republican legislatures, Republican governors, kind of how will that interaction come from market stabilization, especially from, like I said, short-term limited duration plans, association health plans, waivers, kind of the states where that was approved. How will that relationship happen, and kind of what types of Medicaid or innovation waivers will this administration approve for the states, that maybe there could be some collaboration between different parties from the administration to a state legislature. So I think it'll be interesting. And the last thing I'll say is, and I think I forgot to mention earlier, is that I think sometimes what we work on a state can filter up to the federal level. The things like step therapy that we've passed for years on a state level make its way on to the federal level, and so I would say, kind of, if you want to make things a priority because they can move quicker, work with us on a state level, because then they may make its way into kind of an administration or Congress's priorities in the years to come.
Yeah, that's a good point. Increasingly, we're looking at these issues not as state versus federal, but all encompassing, which is why Elisa covers the entire gamut of policy issues, state and federal. It's just increasingly the world is moving that way. And I think that's an exciting opportunity. There are so many ways for everybody to work with us through this, whether it's traditional kind of contacting your member of Congress about legislative opportunities, or really, really important is helping us collect data on your experiences through surveys, focus groups, et cetera. That I can't tell you how valuable that is and how much that helps us when we're talking with policymakers. So keep contributing to the story bank and things like that. And as we send out surveys and opportunities to work with us on focus groups and things like that, we just really welcome your participation in those opportunities.
We'd love to know what topic areas and policy focus areas that are of interest to you, things that maybe we haven't talked about before that you're curious. I know there's a lot of talk about COVID-19. We might have a special coming up, I think, next year with some of our other colleagues in patient education. But if you want to deep dive on policy areas, please let us know. We're happy to do, one-on-ones. We're talking about a series of training videos as well to kind of do highlights and overviews. But if you want a deeper dive in something, let us know. And if you have questions about becoming involved locally, like we all said, reach out to your state advocacy chair for local engagement opportunities, state level. They can really be a great source for answering a lot of those questions, and they can bubble them up to us. But you're also welcome to email us directly, advocacy@arthritis.org, of course. And we're right at 4:01. So I hope that all of you enjoyed our program today. We are very excited to launch into the new year. We made it. We Zoomed, we cried, we laughed. We're here. It's almost the end of the year. Again, please feel free to reach out to us and take care.